Well, towns and cities across the country are getting hit and hard by the flu, but some big companies are doing what they can to fight back. Meg Tirrell looks at the big business behind the big illness.
I wasn't able to walk or do nothing.
Flu is widespread in 49 states and Puerto Rico in a season that's shaping up to be more severe than usual. But while flu brings misery to those suffering from it, for some segments of the healthcare industry, flu season brings healthy returns. Hospitals and urgent care clinics see an uptick during severe flu seasons, while lab testing firms and makers of diagnostic tests also get a boost. The same goes for pharmacies as customers visit for medications, flu shots, and supplies. And finally, makers of flu vaccines are expected to see a boost as public health officials encourage everyone to get their flu shot.
Get vaccinated. And if you haven't been vaccinated yet, run and do it. And make a New Year's resolution to get vaccinated again this fall and bring the whole family with you.
The market for flu vaccines is dominated by three major players: Sanofi Pasteur, Australian biotech companies CSL, and GlaxoSmithKline. And the recommendation to get a shot stands even as the vaccine is thought to be less effective this year at protecting against the flu, primarily because of the more difficult strain in circulation. But it's not all a boon to the healthcare industry. Health insurers often take a hit in more severe seasons as they pay for more care. And employers could also see a loss in productivity from sick days.
We're predicting about 11 million Americans will fall ill over the flu season, and that's going to cost employers over $9 billion in wages being paid to employees that are staying home sick.
Despite that cost, HR experts and public health officials say encouraging employees to stay home when sick is beneficial for both stopping the spread of flu and avoiding even more lost productivity. Showing up for work when sick even has a name: presenteeism. And many of us do it, even though we know we shouldn't. In a survey last year by urgent care provider CityMD, almost 70% of responders said they'd gone to the drugstore or pharmacy when they had flu-like symptoms. 43% went to the grocery store, and almost 40% had gone to work sick. Experts recommend employers take a few steps to help reduce the spread and the potential cost of flu, discouraging presenteeism through enabling telecommuting and through flexible sick leave policies. This can be a particular challenge for hourly workers. And for those in office settings, holding fewer in-person meetings. And of course, encouraging lots of hand washing and covering coughs and sneezes. For Nightly Business Report, I'm Meg Tirrell.